Good morning, everyone. We are going to wait at least another minute or two prior to us getting started. However, we do want to welcome you to our live webinar, Understanding the Impact of COVID-19 on Domestic Violence. And so we are excited that you're here with us on this morning. And so again, thank you for joining us. We will be getting started in about another minute. Thank you. All right, everyone. Good morning. I am Tina Fox, and we'll talk a little bit about myself here shortly, but just wanted to remind everyone that it is October, as we know, and it is National Domestic Violence Abuse and Awareness Month. So again, welcome to those I have not had an opportunity to welcome. We do welcome you to our live webinar. So let's get started. So this morning's conversation will be centered around understanding the impact of COVID-19 on domestic violence. And one of the things that we do know is that the jury is still out, obviously, because we're still in the pandemic, but the jury is still out. However, there are some early findings. And so we will be looking at those early findings on this morning. So who am I? Again, I am Tina Fox. I am the Assistant Director of Programs with the Tennessee Coalition to End Domestic Violence. But most importantly for me, I am a sibling of 4. I am an aunt, and the picture that you see there is my youngest brother and his son. My youngest brother is a Memphis police sergeant with the Memphis Police Department. And his son is a brand new Memphis police officer. I am a native of Memphis. And so that's who I am as relates to my immediate family. And then I have some grand nieces. And so I love hanging out with them. This is the most recent picture of us from last week. We went out to have some fun during the fall break. I am a Tennessee State University graduate, very proud Tennessee State University graduate. In fact, I enjoyed it so much that I went to get my graduate degree from Tennessee State University, the HBCU of the state of Tennessee. In 2018, while I was the State Director of Victim Services for the Tennessee Parole Board, I received a national honor from the Office of Justice. And so I am receiving my award there during National Crime Victims' Rights Week in 2018. So I am a recipient of a national award. One of the things that I enjoy most is I enjoy getting on my bike, cycling. And so you see me there outside. I am an outside person. I also did this for the very first time a couple of weeks ago. Got a chance to get out on the water and enjoyed myself. And just last week, I was able to jump on a horse and we went horseback riding. And so that's just who I am, a little snippet of who I am. And again, I am honored to be here with you all this morning. And I am thankful that you all were able to join the live webinar. So let's set some community guidelines, okay? Community guidelines. We know we are learning virtually. However, what I do know and understand is that there may be a need for you to step away Domestic violence is a heavy topic. And so some of the things that we'll be discussing this morning could trigger. And so if it does, just take a moment to step away, take slow, deep breaths if you need to. We also want you to be accountable because at the end of the webinar, you will have an opportunity to take a survey and receive your certificate. So we do need for you to be accountable. And then finally, ask questions. If you have questions, please use the Q&A box so that we can get those questions answered for you on today. All right, so let's look at our learning objectives, and we'll be real brief with the learning objectives. Recognize the types of abusive behaviors, increase understanding of the dynamics of domestic violence and the impact on victims. Additionally, increase understanding of why victims stay in abusive relationships. Understand why domestic violence is prevalent during the pandemic. And then finally, we will explore tips to help family members and friends and associates who are experiencing domestic violence or who you may sense is experiencing domestic violence. So those are our learning objectives for today. Who remembers the Violence Against Women Act? We recognize that in 1994, Congress passed the Violence Against Women's Act. And so what this, first of all, I'm going to put this out there. And so Megan, who is our training coordinator, she is with us on this morning. If she can help me monitor the Q&A box or the chat box, it would be greatly appreciated. Who knows who was the force behind the Violence Against Women's Act in 1994, roughly about 27 years ago? This little young senator, 27 years ago. Does anyone know? All right, so that young senator is now the president of the United States. President Biden was senator at the time, and he was literally the force behind the Violence Against Women's Act, and he sponsored the bill, and obviously it passed. And so this act recognizes that domestic violence is a national crime and that federal laws can help in overburdened state and local criminal justice system. And so that's the premise behind the Violence Against Women's Act. I wanted to start there with this act, along with one of the things that we don't talk about much is that crime victims, domestic violence victims have rights. They have rights in Tennessee. And we hardly ever talk about that piece of domestic violence, but I just want to allow these rights to serve as reminders that domestic violence victims, that all victims do have rights. Victims have a right to confer with the prosecutor about their case. They also have a right to be free from harassment, intimidation, and abuse. The right to be at all proceedings where the defendant has the right to be present. These are domestic violence and all victims' rights. And we're emphasizing domestic violence victims. They have a right to be heard when relevant at all critical stages of the criminal justice process as defined by the General Assembly. From beginning to end, all domestic violence victims have a right to be a part of the system. They have a right to be informed of all proceedings from beginning to end, and of the release. They have a right to be notified when the offender is going to be released, transferred, or escaped, if and when applicable. They also have a right to a speedy trial or disposition and a prompt and final conclusion of the case after the conviction or sentence. They have a right to restitution from the offender, and we know that offenders do have a responsibility. This is one of the ways we keep them accountable, by making the victim whole again financially. And then they have a right to know about each of these rights established for victims. And one of the things that I want to add to this list is that victims have a right to be treated with dignity and respect. Dignity and respect. So again, these are the rights for victims. Again, we don't talk about this as often as I believe we should. And so I wanted to make sure that we inserted it into today's presentation that crime victims, domestic violence victims, do have rights. Right, so let's look at a couple of facts. If there's already a pattern of domestic violence in a home, stress factor like COVID-19 can increase conflicts and create more abuse. And that's fact number one. Fact number two, the COVID-19 pandemic, as we know, literally has exacerbated the domestic violence crisis by further isolating many people. And we know that domestic violence has a component of isolation, and we'll talk about that here shortly. But these are two quick facts as we kick off our conversation. I want you to think about these two questions. These two questions should make you go, okay? So question number one, why is domestic, family, or intimate partner violence so prevalent during the pandemic? Why is domestic, family, IPV so prevalent during the pandemic? Again, a question that should make you go, Let's look at the second question. What can we do to prevent and address this issue now and in the aftermath of the crisis? What can we do to impede and or prevent and address this issue now and in the aftermath of the crisis? Two questions I want you to ponder because these should make you go, One, why is domestic violence so prevalent during the pandemic? And then secondly, what can we do to prevent and address this issue now and in the future, way after the pandemic has ended? And hopefully and prayerfully, this pandemic will be coming to an end. So this is what we already know. What we know is that domestic violence has been a persistent and prevalent problem in this country for years, especially during the pandemic. This is what we already know, okay? And the other piece to this is during the 1700s, you all may remember some of your history, but during the 1700s, for about 4 decades, for about 40 years during the 1700s, it was literally legal for a man to beat his wife with any instrument as long as it was no larger than the margin of his thumb. Thus, rule of thumb was coined, okay? So when we look at domestic violence, we need to look at the history, okay? So again, for about 40 years in the 1700s, it was literally legal for a man to beat his wife. That makes me sad. I hope that it makes you sad as well. Let's define domestic violence. Domestic violence is a pattern of coerciveness. It's about controlling behavior that can take the form of physical, sexual, financial, and emotional. And I also want to add to spiritual as well. There's some new studies out that offenders are preventing their spouse, their significant others from reading the Bible, attending worship service. However, domestic violence has no boundaries. So it doesn't matter if you're from my hometown of Memphis, Tennessee, all the way to the Tri-Cities out in East Tennessee, domestic violence has no boundaries. When we look at domestic violence, we need to look at two words, power and control. Domestic violence is about power and control. Let's look at the cycle really quickly here, because before we have this discussion of understanding the impact of COVID-19 on domestic violence, we do have to understand the history, okay? So let's look at the domestic cycle of violence here. And so what we do know is that there is this seduction, making peace phase. And so if you think about it, if you went out on a date with a man and a woman, because we do know that domestic violence does affect men. However, we know that 85% of all of the domestic violence cases affect women. And so we'll use a woman for this example. So if a woman goes out on a date with a man for the very first time and he hits her, would she go back out with him? Chances are she wouldn't. Why? Because there are no emotional attachments on the first date, right? And so the emotional attachments begin after the offender begins to groom the victim, okay? And it doesn't happen on the first date or the second date. Typically, it's months after he has done a really good job of grooming the victim. And then from there, the tension builds. He has not hit her yet. He may have shouted or said some things that may have led to her to be concerned. But remember, he has started to groom her. And so she is becoming emotional. And we know that if we are emotional, it's hard to be rational. That's why on that first date, if he hits her, she is not emotionally attached. She is rational enough to say, hey, you know what? I'm calling the police on you, or I'm calling my brothers, or I'm calling somebody, and I am not going to go out on a date with you anymore. That's on the first date. That's why the abuser doesn't do that on the first date. It's a cycle, okay? And then as we continue the cycle, that's when the explosion happens. This is when he begins to hit. Again, this is not an overnight cycle. This is a process of grooming. And so the cycle goes on and on and on. And what I want us to also look at right there in the center, we see love, hope, dreams, possibility, denial, and fear. In the center is where the victim lives. In the center is where she is remembering how much she thought he loves her or loved her, and so she's remaining. She's hopeful that he will desist from being abusive. She's having these dreams of having a happy family. What is the possibility of him literally stopping this abuse? And so you see that, and of course, we look at denial when it comes to victims, and obviously there is some fear, right? If it happened once, she's afraid, and it happens again, she's even more afraid, and then the fear just continues. So I wanted us to really understand how domestic violence works with this cycle. Okay, again, it doesn't happen on the first date. It happens months and sometimes years after the offender contends that the victim is well groomed enough where he can begin the tension building phase. So common signs of abusive behavior in a partner include, as we may know, there may be some on here who may not necessarily know some of the signs, but a sign could be telling you that you never do anything right. Imagine if a victim who has been groomed, well groomed, hears that you have never or you don't do anything right. Or showing extreme jealousy of your friends, time spent away from them, the insults, preventing or discouraging you from spending time with friends and family. Remember, we talked earlier about that isolation, and we'll get into detail about isolation later. Pressuring you to use drugs or alcohol, intimidating you with weapons, intimidating you through threatening looks or actions. Now, mind you, these are not the threatening looks that we got when we were children growing up, right? When we were children growing up and we were out of place, particularly in public, I remember my mother looking at me a certain way, and I knew what that meant, okay? And so, but this is not the same type of threatening look, okay? Destroying your belongings or your home. These are just some of the common signs of abusive behavior in a relationship. Again, here's another what we already know. What we already know is, according to the CDC, approximately 1 in 4 women and nearly 1 in 10 men have experienced IPV, sexual violence, physical violence and or stalking by an intimate partner during their lifetime. 1 in 4. And so there are approximately 30 of us on this webinar currently. And so when you start looking at the numbers, either we know someone or we have been in a situation that was deemed abusive and or we are coming out of that relationship. Either way, 1 in 4. And so that's about 25% of us who are on the webinar on today. So just think about those numbers, okay? And one thing that I know about numbers is that numbers tell the truth and numbers do not lie. All right, so what is the $1 million question when it comes to abuse? Does anyone know? Can anyone chat out what you believe the $1 million question is? The $1 million question. Anybody? All right, so that we can move as expeditiously as possible through this webinar, here is the $1 million question. And it is, how many times have you heard, why doesn't she leave the abusive relationship? Right? How many times have you heard that? Why does she stay? Absolutely, Tamika, I appreciate that. Why don't victims leave? That is the $1 million question, okay? And so we will look into reasons why victims stay. That's a question we should not be asking. Why doesn't she leave the abusive relationship? We also have a $10 million question that we're going to ask as well. So when we look at why abused women stay in abusive relationships, please keep in mind that women have been groomed. Okay, again, remember the thought of that first date. It's not going to happen on the first date. Okay, so she feels emotionally trapped. Remember, I used the term emotional earlier. She has nowhere else to live. When you think about, she doesn't want to break up the family. She believes he will change. She believes he won't do that again. Why? Because he has said, I'm sorry. He follows it up with some roses, some candy. He opens the door for her. He does all these things. And so in her mind, she believes he will change. She fears the abuser. Another reason why she stays. She lacks support of family and friends. Remember, he's already isolated her. So she doesn't have that support from family and friends in most cases. She believes she provokes it. She believes it's all her fault because he has trained and groomed her to contend that it's all her fault. She may not even realize that it is abuse. And that's why we're having this webinar. We have been out the entire month thus far in October, and we will continue because we believe that an ounce of prevention is worth a pound of cure. And just making our city aware, making our state aware that this important topic needs to be discussed. She is afraid to leave because lack of money in most instances. He has told her she doesn't have to work. He's going to take care of her. And he's doing all of this, remember, during the grooming phase. And she still loves the abuser. Okay, remember, she is emotionally attached. And whenever we are emotionally attached to someone, love is going to pop up. Okay, so these are reasons why women stay in abusive relationships. And so we shouldn't ask that $1 million question anymore. Why doesn't she leave? She has reasons, not excuses. She has reasons for her not to leave. Now here's the $10 million question. Who knows what the $10 million question is? Anyone want to chat it out real quickly? The $10 million question. Remember, the $1 million question is, why doesn't she leave? So let's figure out what the $10 million question is. Does anyone know? All right, so we will continue to proceed. The $10 million question is, this is what we really should be asking. Why does the offender batter? That's the question we should be asking. We shouldn't be asking why doesn't the victim leave? The question should be, why does the offender batter? Why is the offender so abusive physically, emotionally, psychologically, spiritually, mentally, financially? Why does the offender batter? So let's look at it. So what we know is that abuse happens because society says it's okay. Society has not held batterers accountable. We know this based on laws, based on the victims' rights that we just finished going over, right? So when we look at society has not held batterers accountable, we have to look at our criminal justice system. Most domestic violence cases are considered, if it's not with a known weapon, considered a misdemeanor, 1129. And then in Davidson County, they have this 12-hour hold period where the offender has to be incarcerated for 12 hours if he's caught and it is deemed that it is a domestic violence case. And so after that, what happens, right? And so this cycle of not keeping in or having the offenders held accountable, it's our fault. And so that's why we, again, are having these types of conversations so that we can understand that domestic violence is preventable, okay? It works. The victim is so afraid that she believes, right, that he will say or do anything to survive. She is trying her very best to survive, and he knows it. And so his job is to remember, groom her. And he has done that well. And so domestic violence works. It shouldn't, but it does. Okay. And then lastly, it's a choice. Okay. Remember, domestic violence is preventable along with most crimes. Batterer chooses to use violence to control their intimate partners, including their children and family members. So why abuse happens? Because society says it's okay based on what we see in our laws with the criminal justice system. Domestic violence, regrettably, unfortunately, works. And then it's a choice. A batterer chooses to batter, okay? No excuse. He chooses to batter, and she does too when it comes to men being abused. The most dangerous time for victims, 75% of domestic homicides occur when the victim is in the process of leaving or has left the batterer. Domestic homicide. That simply means that she has a 75% chance of being murdered by trying to leave. That's the most dangerous time for victims. Who knows what is the second most dangerous time for victims? Anybody? What is the second most dangerous time for victims to leave? Anybody want to chat that out? What do you believe the second most dangerous time for victims? What we know is that on an average, women make about 7 attempts to leave an abuser before permanently ending the relationship. And again, unfortunately, sometimes that ends in death, where she is actually murdered. The second most dangerous time for victims is when a woman is pregnant. When a woman is pregnant, when the victim is pregnant, is the second most dangerous time for victims. So keep that in mind. So here are some important questions. I do want us to get involved with these questions. So if you can please chat out. We do have 3 important questions or statements that we're going to ask. And so here we go. Let's go. True or false? What do you think it is? The pandemic has overshadowed the national conversation about domestic violence. True or false? True or false? Let's chat out what you believe the answer is. Okay, we're getting some results in. Okay, all right. Okay. So the correct answer is true. It is true. And I appreciate you all participating. It is true. The pandemic has overshadowed the national conversation about everything, okay? But specifically and especially domestic violence. Let's do another one real quick. True or false? Here we go. Research is beginning to indicate that violence during the pandemic is not intensifying. True or false? Research is beginning to indicate that violence during the pandemic is not intensifying. I see that you all are coming up with these answers. Thank you all so very much. And let's see, and you're absolutely right, false. Okay, that answer is false. Okay, let's do one more, true or false. Here we go. Instead of bruises and cuts, there are more knife wounds, strangulations, and gunshot wounds during the pandemic. True or false? Let's check that out. What do you all think that is? Instead of bruises and cuts, there are more knife wounds, strangulations, and gunshot wounds during the pandemic. Yes, that is true. That is absolutely true. Thank you all so very much for participating. And so, let's continue this conversation, okay? This is a much needed conversation. And what we're hoping to do is to change the narrative. And now we're going to really get into understanding the impact of COVID-19 on domestic violence. Remember what I stated earlier, and that is the jury is still out because we're still in the pandemic. However, there is some early research that points to COVID-19 having an impact, a serious impact on domestic violence. What we already know, I've stated this before, that domestic violence is preventable. It is preventable. And then secondly, domestic violence is a serious public health problem. And I will contend that not only is it a problem, that it is also a crisis that affects millions of Americans. Remember what we stated earlier, and we may already know this, is that domestic violence does not have any boundaries, no boundaries when it comes to domestic violence. All right, so who remembers last year, March 11th, 2020 is one of those questions. Do you remember where you were during the O.J. Simpson case, right? Do you remember when you were on 911? And so this is going to be a question that's going to hang around as well. Where were you on March the 11th, 2020? This is when the World Health Organization declared COVID-19 a pandemic across the globe, March 11th, 2020. Family violence is a hidden pandemic happening alongside COVID-19. We have got to know and understand that we are dealing with a pandemic within a pandemic as it relates to domestic violence. The rates of family violence are rising and they are continuing. The rates are continuing to rise fast when women and children in particularly are especially disproportionately affected and vulnerable during this time. Perhaps I should not have put those two adverbs there together, especially and disproportionately. However, they are there. Okay, but the point is family violence is a hidden pandemic happening alongside COVID-19. So while the nation has been following public health instructions to stay safe at home, and most of us know that there were some executive orders issued from the local government to the state government telling people, particularly last year, to stay at home. To comply with the CDC guidelines, to practice physical distancing, to wash your hands. Well, as we know, this stay-at-home order was executed and things began to close down. One of the things that no one thought about was domestic violence victims being at home with their abuser 24/7. So here, families spent days at home, relentlessly, endlessly at home. And of course, this sudden life change caused tension and in some cases led to abuse. And early studies are indicating that those persons who were not typically an abuser started to become frustrated because he lost his job. The children are at home. We'll talk about this during school, and frustrations and exasperations, all these things started to happen during the COVID-19. Again, we were not prepared for the pandemic. However, we were especially not prepared for the pandemic as relates to domestic violence victims. And we have to note here that there is no excuse for domestic violence, even during a pandemic, because remember, domestic violence is preventable. We can prevent domestic violence. So because most abuse hinges on isolating someone emotionally and physically from the outside world, remember we talked about that earlier, that it is the goal, it is the objective of the abuser to isolate the victim. And so being in a pandemic makes this a reality, makes this an opportunity for the abuser to solidify the isolation. And so again, while we are at home, everyone is not safer at home because this pandemic has revealed to us this important piece. So when a victim is trapped at home with an abuser or a spouse, they are in immediate danger because there is nowhere for the victim to go, okay? Now, if there is a gun in that home, particularly female victims are 8 times more likely to be killed. 8 times more likely to be killed when there is a gun in the home. Remember, she doesn't have anywhere to go. The executive orders have been issued. No one is going anyplace, okay? So here is a special note that is a fact based on research that during the pandemic, gun purchases soared, okay? Yet a Johns Hopkins study showed that firearms are only the second highest risk factor of domestic homicide. Think about that. The second highest risk factor of domestic violence. So gun purchases soared during the pandemic. So let's look at some of the challenges, So within these challenges, I found there were some common themes. Let's look at the common themes first, okay? First, reports of domestic violence increased during the pandemic. Keep in mind, this is solely about the pandemic. Reports of domestic violence increased during the pandemic. Calls to domestic violence support services spiked, as we can imagine. And then there are decreased resources. These are some of the common themes as I was doing the research. Again, reports of domestic violence increased. Calls to domestic violence support services spiked, and then a decrease in resources, okay? So during the COVID-19 quarantine, the home became a dangerous place for victims while individuals were living in forced close quarters. So the question becomes, when does a home become a dangerous place for victims? Think about that. This is where she abodes. This is where he abodes. This is where they reside. And it is a dangerous place for victims. Think about that, okay? Because that is a fact. As we continue the challenges, we know now that the closure of schools and workplaces left some survivors trapped in violent homes. If a victim prior to the pandemic was in an abusive relationship, she had children, she could at least get out and take the children to school or walk the children to the bus stop or whatever the case may be. But during the pandemic, there was nowhere for victims to retreat, nowhere, okay? They'd have access to those usual networks that were available, perhaps talking to the bus driver of the kids who she was dropping off, or making contact with an educator, a school teacher. All of those things literally were shut down. So it impacts domestic violence. Abiding by shelter-in-place guidance meant that some survivors couldn't make calls to hotlines or to police without being overheard by the abuser. Keep in mind, as we already know, she's at home with him. He's at home with her 24/7 because of the safer at home executive orders, and the fact that perhaps he was laid off because, as we know, there were a copious amount of employees who were laid off during this time. And so he's at home, she's at home, the children are at home. And so she's already in an abusive relationship. And so now it is literally exaggerated because she's not able to make a telephone call without him and or send a text message without him knowing about it. So then you look at the news stories. News stories led some victims with the false impression and fear that police were not responding to calls, that courts were closed and shelters were full or unavailable. I recall listening to some of the news. I am not a news person. I try not to listen to and or watch the news regularly. However, during the pandemic, it was all over the place. Everywhere you turned, even on the sports channel, even on Hallmark channel, during the commercials, you would see something about COVID-19. And they were trying to get the PSAs out there so that we can understand what we need to do. However, during these news stories, if a victim is sitting there watching it and she's hearing information that, hey, the shelters are full, and she's trying to escape. So in her mind, where can I go? If she's saying, if she's hearing 911 calls are slow because police officers, contract COVID as well, right? And so there's a short of staff. And so she's hearing these things, which is a challenge during this time. Additionally, news stories about the spread of the COVID in jails. I remember reading a story that from Sheriff Hall here in Davidson County, who was the sheriff of the Davidson County Sheriff's Department, talked about how many inmates had contracted COVID-19. And I know that Tamika Dobbins is with us. She is the director of victim services for the Tennessee Department of Correction. And so what we know is, and help me with this, Tamika, and that is COVID-19 got into the prisons as well. And so when you start hearing these stories, the victim is thinking, well, if I call the police, they're not going to keep him locked up, or they're not going to lock him up because COVID-19 is already in the jails, okay? And she may fears that, hey, if I call the police, he may contract it, right? And so there are those challenges. Thank you very much, Tamika. Then additionally, measures of limited mobility, such as, and I like to really say physical distancing, the stay-at-home orders, closure of non-essential business, travel restrictions, even vaccinations and quarantine have slowed the spread of COVID-19. It has worked. That's what we do know, that it has worked, okay? Just that limited mobility and getting vaccinated and keeping your hands washed and practicing physical distancing, it has worked. However, okay, even though those measures were in or are in place and they have proved to be useful for infection control, they brought a series of negative social consequences to domestic violence victims, including women and children, okay? So what we have found is that although measures have worked for slowing the spread, it did not slow the spread of domestic violence. In fact, it increased it. Again, these are findings in early studies. Another challenge or two, isolation, limited social contact with families and social services. Now, as we talked about earlier, the abusers or the offenders' one of the goals is to isolate. So when you add COVID-19, where everyone is at home, perhaps the family that was isolated probably could at least connect with the victim on an occasion or two. But here, during the pandemic, it was like strict isolation, okay? And that literally could impede victims from getting or seeking the help that they need, okay? Scholars have suggested that new forms of family violence may have occurred. For example, and when I saw this, I had to put this in here, is that abusers may threaten or threatened to infect their family members with the virus. So you think about the psychological impact that the victim has from the abuser. He is threatening her, and I'm going to give you COVID-19. Think about that. So again, just trying to understand the impact of COVID-19 on domestic violence. So what we found also is that COVID-19 created an environment where victims and aggressors or potential aggressors in a relationship could easily separate themselves from each other. You're in a home and you have to be there. Okay, you can't even go out to take a breath of fresh air without him following you, without him making sure that he keeps his eye on you. So not only is this psychological, but it's damaging that she's not able to separate herself, not even for an hour or two, not even to have that usual routine or walking the kids to the bus stop. That extra stress could cause mental health issues. Remember, it's psychological, increasing individuals' perceived stress and reactions to stress through violence and other means. This is real, as we know. Domestic violence is real, it's preventable, and then COVID-19 has contributed to adding to it. And so what we know is that according to the National Commission on COVID-19 and Criminal Justice, is that domestic violence incidents increased 8.1% on average following stay-at-home orders. So as soon as our mayors, our governors, those who are in charge says, hey, stay at home so that we can slow this spread, 8.1% on an average of domestic violence increased. Think about that, okay? This is why COVID-19 has definitely impacted domestic violence. So growing evidence shows the pandemic has made domestic violence more common and often more severe. Remember we asked that question earlier about strangulation and gunshots. Growing evidence, again, the jury is still out because we're still in this pandemic. However, early research is showing that this pandemic and domestic violence is more serious, and that we had not thought about the seriousness of domestic violence when it comes to COVID-19. The pandemic obviously has given abusers more tools, more chances to control victims and survivors. So literally the offenders have taken advantage of the pandemic. How sad to take advantage. The abuser says, hey, you can't go out, you're not going anywhere. And the government also is saying you have to stay in. And so in the victim's mind, hey, I can't go anywhere. They're telling me to stay in. He has told me to stay in. He has already told me to stay in. So where can I go? Okay. So here's another special note. COVID-19 doesn't make an abuser. We have to know that, right? Because what we know is that domestic violence is preventable. So it doesn't matter about any natural disaster, whether it's a tornado or hurricane or whatever the case may be, COVID-19, those things don't make an abuser, okay? So keep that in mind as we continue. So what we know is that the state of Tennessee has been in the top 10 of men murdering women for years. So the latest data, according to the Violence Policy Center, is that Tennessee is in the top 10. That's nothing to be proud of, okay? We have been in the top 5 for years. I am elated to know that we are down to 10. However, when you look at, let's see here, let me go back. I want us to look at the number of females who have been murdered by states, okay? So Missouri has 64, and we're in second place at 60. But remember, this is homicide rate per 100,000 females. So although we're in the top 10, we're still up there with the number of 60. We're in second place, okay? So keep that in mind, that we're in the top 10 of men murdering women. According to the TBI, the Tennessee Bureau of Investigation, I'm just going to put up these numbers real quickly here. I want you all to see that in 2020, during the pandemic, 69,385 number of domestic violence calls were responded to by the police. Now, one of the things that frightens me when it comes to domestic violence is this notion that there are some women who don't report. So that's scary to me. However, these are numbers where victims actually call the police. So in 2020, in the state of Tennessee, according to the Tennessee Bureau of Investigation, 69,385 number of domestic calls were responded to by the police, 98 domestic violence murders. Okay, now let's look at 2019. In 2019, you see the difference in the numbers. This is why we know that the pandemic has impacted domestic violence. In 2019, 44,382 number of domestic calls responded by police. This is according to the TBI. Okay, so you see that there is a big difference in 2019 and in 2020. And then there were 85 domestic violence murders. One is too many, as we know. One is too many. However, you do see that there were approximately 13 less murders in 2019 as opposed to 2020. So Patty is asking, so we are second in the nation for domestic murder. Actually, we are, but remember, it's per 100,000 per capita. Okay, but that's a great question, Patty. Thank you for asking. And also, Patty, thank you for attending. Very good question. All right, so let's look at another challenge. Almost half of law enforcement calls are related to domestic violence. So when we look at the number, 50%, okay, almost 50% of every call, every 911 call is domestic violence related. So right here in Nashville, Tennessee, from March to July of 2020, just last year, this is the Metro Nashville Police Department received more than 10,000 domestic violence calls. March, April, May, June, July. You're looking at 5 months of at least 10,000 domestic violence calls during the height of the pandemic, right after the executive orders told us to stay at home. The FBI reports that a woman is battered every 9 to 12 seconds in this country. And then additionally, the challenge is 3 to 4 million women are physically abused each year. And so many of the abused women are beaten as frequently, and this is according to the report, once a week, or even daily. 3 to 4 million women are physically abused each year. So victims can't call police because they can't physically distance themselves from the abuser long enough, especially if they have no workplace to go. And we know that's true, right? So we know that particularly in 2020, after March, people were being laid off, okay? So the victims can't call the police. And another reason is the fear that the police themselves may bring COVID into the home. So she's thinking, hey, if I call the police, this is according to studies, the police officer may have COVID, because at that time it appeared that we were all subject to getting COVID. And we had family members to get it. We had friends and associates and colleagues to get it. We had family members to die from it. And so in the victim's mind, if I call the police and he has to come into my house, he could bring COVID-19 into this home. So therefore, I'm not going to call the police. Remember, based on her watching and or listening to the news, these things were reported that COVID-19 is all over the place. And it was, okay? So let's look at law enforcement agencies were operating in a smaller capacity, making victims more vulnerable. One thing about COVID-19, it's just like domestic violence, no boundaries, right? The African-American community was impacted the most. However, COVID-19 still was able to get around and hit a lot of families, right? Including law enforcement, including judges, including those who make decisions every day. And what we found this week is that the Honorable Colin Powell died from COVID complications at the age of 84. So that simply means that all of us are subjected to it, okay? And so when you look at law enforcement, when you look at resources, right? So law enforcement agencies were operating in a smaller capacity because, hey, some of the police officers contracted COVID, right? And so that's the reality. That's a challenge. Another challenge is that the victim survivor faced numerous barriers trying to secure housing. One of the things that we do know in Tennessee is that shelters were full during the pandemic. Again, especially last year. I know at the YWCA, their shelters were full. They had to start using hotels, and they wanted to use the hotels for the men who were being battered. However, they had an overflow and started having to put some of the women in hotels. Okay, so the shelters across the state were inundated with domestic violence victims. Victim survivors experienced difficulty securing transportation, right? And so there was a shortage of transportation drivers, okay? The bus lines, We Go in Nashville, or the MTA, or the public transportation. COVID-19 affected all areas of our lives, right? Again, law enforcement, transportation, medical doctors. We know that medical doctors and nurses became ill. And so this thing is real, and was a challenge that domestic violence victims had to face. They also faced numerous barriers trying to get medical attention, right? Medical attention. And so on the news, they were saying, hey, if you have a small wound, you stay at home. These beds are just replete with COVID-19 patients. The ICU beds are filled. So the victim is hearing all of this, but here she sits at home with a broken arm or with a blackened eye, and she's hearing this. And so she's thinking, hey, I can't even go get the medical attention that I need. And then just securing basic essentials, those basic resources that are important for domestic violence victims to have. Just making a telephone call to a shelter, or making a telephone call to our office asking for some technical assistance for financial or physical needs, toiletries, okay? All of these things during the pandemic made it essentially impossible for domestic violence victims to get to. All right, so as we're about to wrap up, abusers may have intensified coercion and control during the COVID-19 pandemic, and this is how: by including, minimizing, or monitoring victims' communication with friends and family. He was already doing it, but this literally solidified, the pandemic solidified in his mind, gave him a reason. Remember, domestic violence is preventable, and so these are just excuses, but in his mind, these are reasons. Depriving victims of their basic needs, okay? Withholding information about the virus and public health issues. Perhaps he had her to stop watching television, okay? He would get the information. He would not share the information with the victim. Then additionally, go back. Restricting access to the internet, medications, okay, personal hygiene products such as masks, all these things that we were conditioned to being afforded during the pandemic. The abuser literally didn't allow her to have access to those things, okay? If you think about just hand soap and sanitizer, remember, his goal is about power and control, and he's trying to control just the basic essentials that are needed. So the significant changes to routines as we followed physical and or social distancing guidelines and safety protocols led to isolation for many victims. Remember, I said that she was probably conditioned to taking her kids to the bus stop. All of that was cut short during the pandemic. In families, there may be additional stress caused by working from home, caring for children. Remember, everybody is in their environment, in their dwelling. In some instances, as we know, we don't have these large houses, right? And so there could be a 1-bedroom where you have 4 people living, or a 2-bedroom where you have 6 people living, whatever the case may be. The quarters were tight. And so you have everybody there at the same time. Typically, and prior to the pandemic, people were going out and about. And so the victim probably could have been at home 8 hours by herself alone. But now everybody is there. The abuser's there, the children are there, any extras are there. And so it's just hard, especially during school months where the kids had to learn from home. Then that financial piece, okay? If nobody's working, he's frustrated, he's not able to pay bills, she's not able to go get groceries. All these things literally impact domestic violence victims, okay? Not getting her, not allowing her to be connected socially. All these things, again, were cut off. And again, these are things that we didn't think about as professionals. And these are things that nobody really thought about because, wow, we didn't know that a pandemic was headed our way. When we found out about it, the mayor and governor again decided to put executive orders, but nobody thought about the poor old domestic violence victims, okay? And some other things too, but we are talking about domestic violence victims. And then the effects on children, okay? What we know is about 2010, around 5 children were thought to die each day because of child abuse. And what we know is that children who witness domestic violence are at increased risk for developing post-traumatic stress disorder. And one of the things that Janet Reno, who remembers Janet Reno? So if you can just chat it out, yes or no, if you remember Janet Reno. Anybody real quickly? Janet Reno. Who remembers Janet Reno as we come to a close? Janet Reno. Okay, we got somebody. Let's see here. Yeah, so Samantha, yes, of course, Samantha. And Megan, yeah, so Patty, yeah. So Janet Reno was the first woman attorney general, and she served under the President Bill Clinton's administration. One of the things she said was that in order for us to combat crime on the streets, we have got to combat it in our homes. So when we have children who are exposed to domestic violence, it eventually will spill over in the streets. Okay, so we have to do our part. Remember that domestic violence is preventable. So breaking news, okay, you're going to hear this first on Tina Fox, okay, first on Tina Fox. And that is survivors of domestic and sexual violence are at heightened risk now and will remain so long after the pandemic has come to an end. That's why we have to do our part, okay? Get out information, educate, bring awareness about this important topic so that domestic violence victims can get the help that they need. So real quickly, tips for helping a friend and a family member who is experiencing domestic violence during COVID-19. Ask them how they would prefer to connect. Try not to be overbearing. Don't tell them to leave. You need to leave, girl. Girl, if I were you, I'd leave. That's not the language that we need to be using because we're not in this situation, okay? And as we know, it's easier to see inside than to be in. It's easier to see from the outside as opposed to being on the inside, okay? Stay in touch and be creative. Try to come up with ways of being creative, okay? Be supportive and believe them. Every victim should be believed, okay? Help them think through how to stay safe, help them to find a local domestic violence helpline. So these are tips on how you can help. And if anybody would like to have this presentation at the end, please send me an email and I'll make sure that we get this to you, okay? So if someone needs help, okay, I have the honor of working alongside the Tennessee Domestic Violence State Coordinating Council. It was established in 1995, so about 26 years ago, this institution was established to assist domestic violence victims as well as batterers. So to date, we have 32 certified batterers intervention programs across the state, 65 counties. And so the focus there is on victim safety and offender accountability. Offenders are required, according to the State Coordinating Council to have at least 24 to 26 sessions of domestic violence and batterer intervention prior to them being able to move to the next phase. And so, again, Tamika Dobbins is with us, and I know that the Tennessee Department of Correction, they have batterer intervention programs as well for those who have committed felonious offenses. And so we are doing what we need to do so that victims can understand that we are working to make sure that they are being safe, okay? The National Domestic Violence Hotline, we like to use this particular hotline because it has languages for everyone, and it's available 24/7, okay? So here's the number to the National Domestic Violence Hotline if you know of someone who may need the telephone number, okay? So in conclusion, while we may not have the entire picture of domestic violence during this pandemic, remember the jury is still out, okay? Available information points to an increase in incident of intimate partner violence, of domestic violence. And then we need to use the tools we have at our disposal to change survivor needs so that we can serve them in a way that is practical, thoughtful, intentional, and most importantly, safe. Remember that every domestic violence victims have a right to be treated with dignity and respect. Okay, so these are some of my references. Again, if you would like the presentation, just let me know. If you have any questions, I am available. You can email me, tfox@tncoalition.org, or you can phone me, 615-622-6613. So at the end, as we are about to conclude, you have an opportunity, you'll be routed to take the survey. You will be able to assess the presentation and me on this morning. And after you take the survey, your certificate of completion will generate. And so if you have any issues with taking the survey and or accessing it along with the certificate, please feel free to reach out to me. Are there any questions before we dismiss on today? All right. Since I don't see any questions in the chat box, I want to thank you for taking out your time this morning as we continue this discussion, this well-needed discussion on understanding the impact of COVID-19 on domestic violence. Thank you all very much for coming. We appreciate it, and we hope that you will continue to be engaged in activities this month as we remember and honor domestic violence victims and survivors. Hope that you all have a great rest of the day. Thank you. Thank you, Juanita. Appreciate you. Thank you, Sonia. Appreciate you. Thank you, Samantha. You all have a good rest of the day. Thank you.